Hello, and welcome to today's program titled Coronavirus Part 2, Preparing for a Potential Pandemic, New Employer Challenges. At this time, all participants are in a listen-only mode. For those of you who are logged into the web presentation, you are encouraged to submit questions throughout the conference by typing them into the text box on your screen. For those interested in obtaining CLE credits for this webinar, an attendance verification code will be read during the presentation that will be required on the CLE attendance affirmation form. Please write this code down as it will not be reread and it is required for CLE credit. Copies of this webinar recording and PowerPoint presentation will be distributed to attendees in the days following the webinar. At this time, I would like to turn it over to Ben. Ben, you may begin.
Thank you, Osman. Welcome everyone to our second installment on the coronavirus and its impact in the workplace. As everybody knows, this is an extremely fluid situation that's changing moment to moment. We've worked over the weekend to try to bring you the most current info we can in today's presentation, but we encourage everybody to frequently visit the CDC website, the World Health Organization website, and your local health department websites. Before we get started and introduce the speakers today, I wanted to cover a couple of housekeeping items. First, this wouldn't be a law firm presentation without a legal disclaimer. This program is for informational purposes only and does not constitute legal advice. As Osmond said, we will have a place to the right of the screen for you to type questions that we will attempt to answer at the conclusion of the presentation. We've got quite a few listeners today, so I anticipate that we won't be able to get to all of the questions, but we'll try to address those that we think cover the broadest possible audience, so that we cover those issues for you. And there'll be a lot of questions amongst the panelists going back and forth today as we move through the program materials, so hopefully you'll find those questions useful as well. Finally, we've got here at the firm, we've established a COVID-19 task force that is a cross-functional group of labor and employment counselors and litigators, as well as folks from our workplace safety and environmental practice group. And we're working very hard to push out information to our clients and others who are interested on how employers grapple with this public health emergency. So with that, let's introduce the speakers. Cassie, would you move ahead to the third slide, please? So our speakers today, my name is Ben Briggs. I am a co-chair of our firm's National Workplace Safety and Environmental Practice Group. Been practicing in this area for about 20 years now. Also a member of the COVID-19 task force. We also have with us Mark Lees, who is a partner in our Chicago office. Mark has more than 40 years of experience that he brings to the table, and a lot of that, most of it in fact, has been in occupational safety and health work, so extremely knowledgeable and experienced in that space, and has helped guide all types of employers through every recent public health emergency in recent memory. Third, we've got Tracy Billows, who is one of our most sought-after advisors in labor and employment space within our firm. Like Mark, Tracy brings a wealth of experience and knowledge to the table. She's going to talk to you a little bit about some of the more nuanced issues that employers confront when dealing with a public health crisis like this, in particular issues relating to the Americans with Disabilities Act, family medical leave, paid sick leave, wage hour issues, and Title VII. And then finally, we've got Dan Birnbaum, who is a Chicago-based associate in our workplace safety and environmental group. Dan devotes a significant portion of his practice to occupational safety and health work and is very experienced in litigating and counseling in that area. With that, Dan, I'd like to kick it over to you to give us a little bit of background on the coronavirus and an update on the current situation, if you would.
Thanks a lot, Ben. So we've had obviously a lot of updates since our prior presentation on this just a few weeks ago. And I'm looking at the slide following the photo of the coronavirus picture, which we had on our last slide as well. So where we are now, just briefly, is understanding the virus and the symptoms of the virus. First, that infection we still understand to occur through coughing and sneezing, as well as through touching surfaces that have the virus on it. We're now understanding that individuals are more contagious as they're more symptomatic, although there are reports that it may spread when people do not show symptoms, which is why we've been encouraging the 14-day quarantine in some cases, more on that later, and continuing to see the same sorts of symptoms we've previously seen: fever, cough, shortness of breath, as well as death. Noting that the fatality rate is a little bit lower now at 2%, which we still perceive to be high. There's a small sample size relatively, even though there's about 90,000 cases, that's still a relatively small sample size, and we anticipate that as more people are confirmed to have the virus, we'll actually see the fatality rate decrease. And as always, the majority of the deaths have occurred in China, and we still understand it to be a 2 to 14-day incubation period.
Dan, how does the fatality rate or the lethality rate, I think we've heard it called, compared to the flu?
So that's a good question, Ben. So currently, it's actually 20 times the flu. The flu is 0.1% fatality, whereas coronavirus is about 2%. So we get that 20 times number. But to my point, as the confirmed cases increase, interestingly, that the fatality rate we would expect to go down. It's just a very small sample size, and actually, since our last presentation, we've seen the fatality rate go down. So even though there's repeats of more deaths, that's because there are more confirmed cases, and the fatality rate we anticipate will decrease. So moving on to the next. Oh, sure. I'm sorry.
Sorry to interrupt, Dan. We've heard about community cases more recently, and can you explain how a community case differs from other known cases where folks have come in from countries where the spread of the virus is more pronounced?
Sure, and that's a new development since our first presentation. Previously, all known cases had occurred from people with known travel to China or South Korea, or one of the areas with coronavirus, or they had been in contact with someone confirmed to have coronavirus. The community cases are now individuals that either have not traveled to China, South Korea, Japan, Italy, Iran, or they have not had contact, to their knowledge, of someone with a confirmed case of coronavirus, and hence the word community cases. It seems to be spreading through the community.
Thank you for that.
Sure thing. So there's still no vaccination at this time to prevent the coronavirus, although there are, interestingly, a lot of diligent efforts to put it into place. And we've read unofficial reports that there may be a vaccination early to release in the next few months, if not the next year. It just needs to go through testing. But as of now, no vaccination. So prevention tips are still our best ways to avoid contracting coronavirus: covering our coughs, avoiding close contacts with those who are sick, avoiding touching your eyes, nose, and mouth, washing your hands with soap and water, and frequently cleaning or disinfecting surfaces. And there's been a lot of talk about face masks as well as prevention. At this time, the CDC is not recommending that people wear face masks, and there's been some talk about this as well in the media, that they want to make sure, the CDC wants to make sure that face masks are available to health workers, people taking care of someone in close settings, those who are most at risk of coronavirus now. But given where the stage is with the coronavirus, face masks don't seem to be necessary for the general public.
Dan, what do you think about employers restricting business travel? We've certainly heard examples in the media about companies ending that practice, at least for non-essential travel. What kind of guidance are you providing employers in that space?
I apologize. You cut out for a moment. Could you repeat the question, please?
Yeah, in terms of prevention, are employers considering restrictions on business travel, and if so, to what locations?
Yes, yes. So that was actually early on. We'd seen a lot of employers restricting travel, namely to the countries that have been the hardest hit. So again, China, South Korea, Japan, Iran, and Italy. We have seen some employers restricting travel to surrounding areas, but not as widespread. But certainly the business travel restrictions have gone into place. And in fact, the CDC has assessment levels available on their website. Again, a great resource is the CDC's website, which will obviously be updated as this progresses. But you can click on whatever country you're interested in, and the CDC will provide you the most up-to-date assessment level on travel restrictions or their recommendations on travel to certain locations. And then from a business travel perspective, companies are limiting business travel in that sense.
So this is a question for Mark and or Dan. How should an employer deal with employees who have plans to travel to areas that are significantly impacted, the areas that Dan just rattled off, for personal reasons? Is that something that an employer can prohibit or otherwise restrict?
Let me take that one. The employees, every American citizen has a constitutional right to travel outside the continental U.S. if they have a passport. So the answer to that is no. However, what we have been telling clients to advise their employees is if you do take such travel and if you do come back to an area that has been identified as high risk, that one, you're going to be screened at the airport, and very likely there's a possibility that if you are showing signs and symptoms of illness, that you will be taken to a quarantine center for a period of 2 to 14 days, although that now is in question whether or not that's sufficient time. Or if you're asymptomatic, in other words, you don't have any symptoms, you may be able to go home, but you will be required to be monitored and report in to the Department of Public Health, so we know that if you do start to develop signs and symptoms, we're going to get you to a medical provider, and we're going to find out whether or not you have the seasonal flu, or you have the coronavirus or something else. So there is an element of risk if you take the trip. You may not get home as soon as you're planning on it. You may take an unexpected trip to a quarantine center.
Thanks for that, Mark. What about remote work as a preventative measure? Are you all suggesting that to employers who are concerned about the spread of coronavirus?
We, in fact, have been recommending that to employers, and Tracy's going to talk about this when she gets to the Americans with Disabilities and potential accommodations. But many employers now have decided that they are able to allow employees to work remotely. But in some cases, we have also had employers say, and Tracy's also going to talk about this in a little more detail, that they even if the employee can't work at home, they're going to send them home for the 14 days if they've come from some of these areas that have been identified. And then the question becomes whether or not, and there may be some local laws or statutes that allow the employee to be paid if the employee is quarantined. Tracy can certainly talk to that. Maybe now is a good time for you to just talk to that, Tracy.
Certainly, happy to do that. So with respect to whether someone gets paid while they are either quarantined due to fear of the fact that they may have been exposed to or contracted the virus but has not yet just shown symptoms, versus someone who's actually tested positive and or we know has the coronavirus is a different question. There are various paid sick leave laws that exist that, in addition to individuals being eligible to take time off if they are sick or if a family member is sick, if a pandemic is ordered in a particular state by a health official, even if someone is not sick, They may have the ability to take their paid time off. Some of those jurisdictions that have such provisions include Arizona, San Diego, Chicago, Cook County, Maryland, Michigan, Rhode Island, Minneapolis, St. Paul, New Jersey, New York City, Oregon, Pittsburgh, Washington State, Seattle, and Tacoma. So if you have individuals in those locations, make sure you are checking those laws and policies. When I get to the slides about leaves and such, I'll talk about handling exempt and non-exempt employees and some of the pitfalls there. Thank you, Mark.
Okay. Maybe I could just allude to a little bit, too, about this issue of social distancing. We've heard a lot about that overseas, where many events are being canceled, and there's a question mark hanging over the Olympics this summer. We haven't had that in the United States per se. However, medical professionals are telling people to avoid shaking hands with anyone. If you can greet someone with a nod or a shake of the head or a slight bow, that would be fine. If you do shake hands, because of this issue, we don't know about the community infection, they recommend that you, before you put any part of your hand to your face, because the route of infection is through your mouth, through your nose, or in some physicians say through your eyes. That's how the virus gets in. That you wash your hands for 20 seconds with warm water, soapy water, get under your fingernails, make sure you get it clean, or if you're going to use a hand sanitizer in lieu of that the hand sanitizer have at least 60% alcohol by content. And again, work it over pretty well so that you make sure that you are getting your hands clean. If you're touching any things like it's going so far as the button on the elevator, you don't know who touched that before you, or hand doorknobs, things like that. We just don't know. You can't see the virus, and as soon as you put your hand up to your face, you're potentially infecting yourself.
Thanks, Mark. Dan, why don't you take us through the information on the next slide?
What are, in terms of our recommendations, I think we wanted to talk about this, Ben, is we can force employees to stay home for a period of time during the incubation period if we have reason to believe that they may have been exposed, particularly if they have some type of symptoms. But we cannot force them to seek medical care. We can, however, tell them that if you don't go seek medical care and take a kit and find out whether or not you have seasonal flu or the coronavirus, that you won't be allowed to come back to work until we have that particular determination as far as whether or not what type of illness you may have and whether or not it may be the coronavirus.
Thanks for that, Mark. We've got the next slide shows a global map of locations that, as of yesterday, had confirmed COVID-19 cases. Mark, why don't you take us through the White House proclamation and restrictions on entries of aliens who pose a risk of transmitting coronavirus?
All right. This was announced last week. And it was if you look at it, it's very, very detailed. But the president signed off on it with advice from the CDC and other health organizations, and basically suspending entry into the country of aliens who come from certain areas that are designated there, unless you're a special type of governmental official. Otherwise, you can't come into the country if you were in these areas for the 14-day period preceding that. U.S. citizens, as I pointed out before, if you've got your passport, you get to come back to the United States, but you will be screened. And if you are in these particular areas and you're showing any type of symptoms, you may be going to a designated location for further evaluation, a quarantine, if you will. If you're asymptomatic, you'll be going home. And you'll be monitored while you're there. This is subject to change depending on the more information we get, and frankly, we expect it to occur because of the fact that we now have the coronavirus spreading to other locations such as South Korea, such as Italy, and Iran, where no information is coming out.
So Mark, why don't you kick off the discussion of potential employer liabilities with an overview of how the OSHA Act is implicated by this public health emergency.
Very good. And as we know, OSHA regulates occupational injuries as well as diseases at the workplace. They do not have a regulation. They never had one, but they can use their general duty clause, and basically that says that if there's a recognized hazard, and now this is clearly a recognized hazard, it's a world health crisis, and you as the employer do not take reasonable steps based on the medical literature that is out there, then you are failing to protect your employees against this particular hazard. OSHA will defer you, and you go to their website. It's www.osha.gov. By the way, the CDC website is cdc.gov. There's ample information there to tell you how to put a program together. There could be potential liability for citations and monetary penalties if an employer ignores this recognized medical literature and fails to take action. One of the areas that particularly would draw a lot of attention is in the healthcare industry or the transportation industry, airline pilots or bus terminals, where we have a lot of people that are traveling, coming and going. I read the other day that on an average day before this crisis took place, 14,000 people a year arrived from China on the west coast of the United States. So a lot of folks were potentially exposed, and we have to look at that. But healthcare is very foreseeable. For example, when Ebola came in, which is the disease that came out some years ago from Africa, had its origin out there. We had cases in the United States with healthcare workers who were exposed and treating patients. So OSHA definitely looks at this. I will tell you that in terms of OSHA coming out and doing inspections for this, unusual, we have seen complaint letters. What is more likely is that if an employee believes that he or she is in imminent danger means if something is not done right now, I could suffer serious injury or die, they have a right to refuse to work until the employer objectively demonstrates to them that there is no such hazard. Obviously, the employee's belief has to be objectively reasonable, and the employer's response has to be reasonable. And now that we're in this fluid situation, as Dan pointed out before, and you did, Ben, we're not quite sure. We thought it was people just coming in from China in certain countries, but now it may be from the community. But let's assume that the employee says, I came to work, I saw a bunch of people sneezing and coughing. I know that somebody came back from China. I know they came back from Italy. I'm afraid. I don't want to work. And Tracy's going to talk in a few minutes here about certain types of disabilities that makes a person particularly prone to serious injury. That would be protected activity. And in that particular case, we should tread very lightly on any type of disciplinary action under OSHA, Section 11C, regarding an employee who is making that type of complaint, because we don't know whether or not we can establish as a matter of certainty, particularly in certain industries, that there is no other employees or there are no other employees there who are asymptomatic, but in fact may be infectious. In other words, they're not showing symptoms, but they can infect other people. So OSHA does, in fact, look at that. Let's go to the next one. What OSHA does expect is that employers do a hazard assessment, and this is based on the reasonable potential exposure in your industry. Are you the travel industry? Are you the healthcare industry? What specifically are you doing? And then adopting procedures. An easy way to look at this is to put it in three silos. One is information. Get the information out to your employees. Two is medication. If they need to go see a healthcare provider and get better, you go there. And the third one is isolation. That's our quarantine. If you need to have 3 benchmarks for doing that. There may also be requirements to fill out the OSHA 300 log. The only time that would really apply is if the coronavirus is a hazard that is reasonably expected in that industry. So if a healthcare worker contracted the coronavirus and was off of work, that is an illness that would go on to the OSHA 300 log in 7 calendar days, because it's reasonably expected that someone who's treating individuals who may have the virus could get infected with the virus. Let me add one other thing as far as OSHA is concerned. We see people running around with these masks, okay, and typically it's the paper mask. It's a dust mask. It's really not a respirator. All it does is keep you from having gross amounts of dust or other things. That really does not protect you. The vapor, if they're sneezing or coughing, the droplets are so small you can't see them. They can penetrate the paper filter, and the paper filter does not form a fit around your face. So the virus material can get around the outside of that. If you allow your employees to wear those, you must give them Appendix D from the OSHA regulation. And what is Appendix D? It says you're wearing a paper mask, essentially. It's not a respirator. Don't rely on that to protect your safety and health. Now, what some employees are doing is coming into work, they're buying an N95, which is a respirator, and it has a tight fit around your face so that you can't get any of the hazardous material, you can't get it into your breathing zone or your nostrils, okay? If somebody does that, you can't stand by and say, well, I guess I'll let them do that. That is a respirator. And if they decide to wear that, the employer has to implement a respiratory protection program. If you breathe through a respirator, a true respirator, it puts a significant strain or stress on your pulmonary cardiovascular system. And you can, in fact, have a cardiac event, you can faint, you can do other types of things. So in that case, the employer would have to be able to show with a medical evaluation that the employee is capable of wearing a respirator without causing a negative health effect. And secondly, the employee has to be trained on how to wear it. That's how you get the fit around your face so it in fact works. You've seen all these pictures in people running around in Tyvek suits with respirators. Those are full respirators. Employees should not be wearing those at the workplace unless the employer has a respiratory protection program and properly has the documentation on that. But that's very important. People are running out buying these things, and they don't really understand what it's all about.
So, Mark,
Okay,
why don't you
next.
touch quickly on workers' compensation and disability insurance benefits?
Yeah, workers' compensation, as we all know, is the law in every state. It's strict liability on the part of the employer if the employee can prove that the injury arose out of it in the course of employment. Those are terms of art. So the course of employment would be, I got infected at work. But arising out of means that that's a hazard at my workplace. In most cases, employees will not be able to prove a workers' compensation case because the coronavirus is not a hazard that typically arises out of it in the course of employment, i.e. healthcare, transportation industries, things of that particular nature. If, however, you decide, or if it's determined in healthcare, what is the employee entitled to? Reasonable and necessary medical care for life, temporary total disability benefits while they're off of work and they can't work. If they have any permanent disability, in most cases they're not going to. It's a respiratory disease. They're going to recover. But if they have a permanent compromised immune system or respiratory system and they can't go back to work, they may be entitled to some type of disability from the Industrial Commission. One thing we do encourage is that if you do get any cases, people calling in, put your broker on notice, okay? Because if you don't put your broker on notice, they may say, well, you didn't cooperate under the policy and therefore I don't have to pay workers' compensation benefits. We also want to make sure that you engage a competent medical professional, that's someone who knows about occupational diseases, before you accept a claim for workers' compensation. Now, some people are saying, well, as Tracy pointed out a few moments ago, if you pay someone, and she's going to talk about this, if you pay someone while they're off of work, does that mean I owe you workers' compensation? No. A voluntary payment to support an employee, give them assistance, is not an admission that you owe them any workers' compensation benefit. And you're going to say it's a voluntary payment, so you're not creating a precedent. So anytime we have any type of a disease, employees are going to say, well, the last time around I got paid, so I'm going to get paid this time. Disability benefits, okay? This is a matter of contract. Contract can either be a formal contract, a collective bargaining agreement. Are you going to talk about disability benefits? Do you want me to?
You can keep going.
Okay.
I will jump in with some additional thoughts.
All right. If I make a mistake, I know Tracy's going to correct me. She's very good at that, and she's very gentle. Okay. If provided by contract, what's a contract? That's the collective bargaining agreement. That's your handbook. In many states, the handbook forms a quasi-contract between the employees and the employer, or policies that give employees a reasonable belief that they are covered by some type of disability benefits. In this particular case, you may want to review your limits of coverage to see whether or not, if you were to have a mass amount of employees who come down with the coronavirus and they're going to be off for extended periods of time, whether you're going to go through your coverage limitations and whether or not you need some excess coverage. Now's the time to do that before before anything occurs at the workplace. It's pretty hard to buy car insurance for an automobile accident right after you had the accident. And again, in this case, we want to have competent medical assistance to administer the program.
Thanks, Mark. So now let's shift gears to the topics Tracy's going to talk about, FMLA, ADA, paid sick leave. These are some of the more thorny issues that this public health emergency presents, and Tracy's going to take us through that in some detail.
Sounds great. Thank you so much, Ben. I appreciate it, and thank you all for being with us today. Just quickly, by way of review, remember the Family and Medical Leave Act applies to employers with 50 or more employees, and an employee is eligible for FMLA if they work at a location with 50 or more employees within a 75-mile radius. So remember, even if they work at a location that maybe does not have 50 employees, if there's another company location within 75 miles that hits the 50-employee threshold, the employee can be eligible for FMLA. 12 weeks of unpaid leave in a 12-month period for qualifying reasons. I'm going to leave military caregiver leave, which all of you know is 26 weeks on the side for right now, and focus really here in the FMLA on the serious health condition of either the employee or a covered family member. Remember, covered family member is parent, spouse, or child, but also remember there is guidance from the FMLA that clarified that child cannot be limited to under the age of 18. If a child is 18 or older and suffers from a disability under the Americans with Disabilities Act, a parent can request time off to care for that adult child as part of a serious health condition under the FMLA. Mark already covered workers' comp, but remember, if there is a workers' comp qualifying event, you want to be running that concurrent with the Family and Medical Leave Act. The big thing about FMLA that employees like is they get job reinstatement rights. That's job reinstatement rights for continuous leave, and that's also job reinstatement rights for reduced schedule or intermittent leave. Intermittent leave, as you all know, is a day here or a day there. What are the quarantine issues if someone is infected, and how does the FMLA interact with that? Well, first, if someone has in fact demonstrated symptoms of the coronavirus or some other serious health condition, you're going to either apply the FMLA for purposes of the employee's own serious health condition, or if a covered family member falls in the same boat, you're going to apply the FMLA for their care for a family member who has a serious health condition. The big question becomes, though, what if we are quarantining someone just out of precautionary measures, meaning we are not quarantining someone because they've shown symptoms or otherwise have said to us that they believe they have the virus? Remember, under the FMLA, you can only designate it if you have medical evidence of a serious health condition. So if you have someone that you choose to quarantine that does not show any current symptoms, but you are doing so for a precautionary measure, you would not be counting this as FMLA. You cannot take away any of that time from their annual FMLA bank. Having said that, you want to be monitoring the situation closely, because if the individual during the quarantine period does develop symptoms, you need to then afford them of their FMLA rights and give them their FMLA notice, as they would then be eligible to apply for family and medical leave. FMLA is unpaid. So let's talk about all the different ways pay can come into play here. I talked briefly about some of them a few moments ago, which is paid sick leave. Paid sick leave can be used if someone is sick. There's also paid family leave in numerous states. Remember, New York, New Jersey, Washington State. Massachusetts has it on the horizon, Washington, D.C. as well. So make sure you're checking your local laws. Because even though the FMLA is normally unpaid, there are lots of state law rights that could potentially provide pay to individuals under these circumstances, either to care for a family member or for one's own serious health condition. Just briefly on disability, Mark is right. There are various disability plans that are out there. They may be an ERISA plan, they may be a policy, they may be in a handbook, they may be in a collective bargaining agreement. You need to consult those to make sure you understand what is the definition of a disability under those benefits. That definition does not have to equal the definition of a serious health condition, does not have to equal the definition of a disability under the ADA. Oftentimes, these definitions are tailored for benefits purposes and pay purposes only. Please make sure you are checking those because it is possible to have those policies implicated regardless of whether you determine that FMLA and or ADA may apply. If you have someone who you ultimately believe should be quarantined, but perhaps you don't have paid sick leave available or you don't have paid family leave available, I want to remind you all of the wage and hour concerns that come along with employees. So let me talk about exempt employees first. Remember the rule, if an exempt employee performs work of any kind in a given work week, they have to be paid their normal salary for that work week. That includes sending one email, folks. It does not mean they have to spend a minimum of 1 hour or 8 hours or 1 day. Send one email and they get paid for that week. So, in those circumstances, you're looking at whether or not you're going to allow people to telework or work remotely, which I'll talk about in just a moment. For non-exempt employees, as you know, you are not required to pay them a fixed salary per week. They are paid by the hour. I will be honest with you, from a trend perspective, though, we are seeing a number of companies pay these employees as well so that they do not suffer a hardship, so that they do not suffer the impact of being forced into this mandatory quarantine. And ultimately, to the extent they do develop symptoms, of course, they're applying for leave and benefits just the same as anyone else. But do note that while there may not be a legal obligation to pay these non-exempt employees, most employers we are working with are paying them. So please be well aware of that. From an FMLA perspective, what documentation can you get when they return from FMLA? Well, remember, the FMLA has a fitness for duty right. You want to be checking that box on your designation notice that says you are going to be demanding a fitness for duty upon return to work. Fitness for duty in the FMLA world is very different than what we typically see in the workers' comp world, where you're dealing with IMEs and things like that. I guess I should say independent medical exams. Mark has me so well trained in all the acronyms, I don't even have to spell them out anymore. But nonetheless, remember, fitness for duty doesn't mean they go for a second opinion or an independent medical exam. It's a note from their doctor that all it has to say is, yes, they are fit for duty to return on fill-in-the-blank date. So I just want to point out what the fitness for duty standard is under the FMLA versus what you are going to see potentially in other contexts when people use the term fitness for duty. I think I'm ready to transition to the ADA, Ben, unless you've seen any questions on the FMLA you want me to address before I do so.
I had one quick paid sick leave question. Are there any circumstances where a paid sick leave law might apply where somebody is quarantined as a precautionary measure, but ultimately determined not to have had the virus?
There are a couple ways that could come up. So some of this could also come about due to closure of the business, the child's school, the child's daycare providing service, if there's been a public health emergency identified and or declared in a particular community. So in theory, if we are quarantining an individual because of concerns, but there's also one of those proclamations or announcements I just met, we would have to afford them use of their paid sick leave, even though part of the reason they went out was because of the quarantine that was necessary. So it was a great question. You should not assume just simply because you sent them out on the quarantine that paid sick leave couldn't come available.
Thanks. Very helpful.
All right, so let's talk about the Americans with Disabilities Act. We all know that qualified individuals with a disability are protected from discrimination. The other big thing to be aware here, and it's a little bit beyond what we can cover, but there's the other two prongs, which is the record of a disability and being regarded as disabled. I will cover a little bit of the regarded as disabled because there's been lots of questions that we've been receiving about perceptions of individuals, either based on their health condition, their national origin, et cetera, and employers need to tread very carefully in how they are managing those perceptions. First, an employee may develop a disability from the coronavirus or aggravate a pre-existing disability. Remember, a disability is a physical or mental impairment that substantially limits a major life activity or bodily function. In California, cross out that word substantially. It only, under state law in California, needs to limit a major life activity or bodily function. Where an individual is a qualified individual with a disability, they have the right to request a reasonable accommodation provided it does not cause an undue hardship or direct threat to the health and safety of the individual or others. So what are some common accommodations we're seeing? And then I'm going to turn to the EEOC guidance here because the EEOC issued some significant guidance over the weekend. First, possible accommodations, work from home or telecommute. Leave, reduced schedule upon return to work, meaning someone who was ill and they don't feel that they're capable of coming back on a full-time basis. No travel for a period of time. Believe it or not, we see no travel requests even outside of the coronavirus when just the flu season is in effect and other things. So please be aware that this is something that could come up. What should you do with respect to reasonable accommodations? Well, there's a couple different paths that you may find yourself taking here. First, if someone is telling you they need a reasonable accommodation because they suffer from a disability and they are afraid that they could contract the coronavirus of some sort, you have every right to follow your normal reasonable accommodations process and ask for documentation from their physician confirming what are their restrictions and what accommodations do they need. You then need to engage in the interactive process with that individual to determine what, if any, reasonable accommodation exists that will not create an undue hardship or direct threat to health and safety. If it is someone who has contracted the virus and they are coming to you for an accommodation, same thing, you are going to be following your normal reasonable accommodations process. You are going to be asking for documentation, confirming how long the doctor expects they'll need the accommodation, which most likely is going to be continuous leave, and at the end of the day, when they might be able to return. Upon that return to work, you have every right to demand that they give you a clearance that they are clear to return to work, very comparable to the fitness for duty in the FMLA context. So know that you have every right to ask for that documentation. The EEOC's guidance covers a number of different particular questions that you should all familiarize yourself with. First, it defines the direct threat. Remember, under the law, it's a significant risk of substantial harm to the health or safety of individual or others that cannot be eliminated or reduced by reasonable accommodation. Interestingly, the EEOC does not take the position that direct threat automatically equals pandemic influenza. It's saying that it too is watching the CDC and public health authorities' announcements and such to make determinations. I know that's not great news for all of you. You'd like some, clear guidance as to which way to proceed. The one thing that is at least somewhat comforting from the EEOC guidance is that they do say employers are expected to make their best efforts to obtain public health advice that is contemporaneous and appropriate at their location and to make reasonable assessments of conditions in their workplace based on this information. So there is that reasonableness element that the EEOC is looking at, and all of you should as well. Not guaranteed that the EEOC won't take issue with certain employer actions, but it is at least nice to know that they're acknowledging that. The EEOC also gives you some guidelines on how to have some inquiries with employees. For example, are there ADA compliant ways for employers to identify which employees are more likely to be unavailable for work in the event of a pandemic? They give you a general question that they say you can ask that doesn't just focus on illness issues, but just basically says, would you be unable to come to work because of one of the following reasons? And they identify all these reasons, including a medical reason. So please make sure if you're looking to do any type of broad-based communications to employees to prepare for some sort of pandemic here, you need to make sure you're looking at the ADA guidelines, because you cannot make unnecessary medical inquiries. And the EEOC guidelines is not giving employers a lot of wiggle room in that area simply because of what's happening with the coronavirus. Some other things just confirmed by the guidance, which I know all of you know, you can send an employee home if they're displaying influenza-like symptoms during this time period. You also can, certainly make sure that employees know that they have to call in sick, that they have to provide you appropriate medical documentation. I will tell you, the one interesting thing that keeps coming up is taking employees' temperatures to determine if they have a fever. The EEOC issued very specific guidance on this. You're going to want to take a look at it if you are planning on taking that measure. The EEOC says generally measuring an employee's body temperature is a medical exam. If this pandemic becomes severe enough, then employers may get to the point where they can do so. However, they have not yet concluded that employers can wholesale start taking people's temperatures, absent some other evidence to suggest that there is a risk. They talk about also possible accommodations, including teleworking. They talk about personal protective equipment, which I'm going to leave alone because my colleagues have already very well taken care of that. And then I just want to talk a little bit about this sort of regarded as and acting on perceptions. Unfortunately, people are going to be very nervous and worried about what is happening with individuals, right? And people may say, I know this person is from that part of the world, or I know this person has a medical condition and they've been coughing and sneezing lately, right? That must mean that they're going to contract the coronavirus. We cannot act on those stereotypes and assumptions. We have to act based on factual information. So please make sure that you are managing that. And, certainly you can say to employees, look, we treat these situations as confidential. Know that we are on top of this. We are monitoring things. And certainly to the extent we think there is a risk, we will communicate that to you. But you do not have to provide and should not provide information to other employees that's confidential to an employee's medical status, that's confidential to a disability, that's confidential to any other information related to their personal health, their family members' health, or anything else that might be associated with that. And with that, let me talk a little bit about the return to work process briefly. We've talked a little bit about, yes.
Tracy, I had a question for you because I'm seeing a lot of questions from the audience that touch on this. What advice would you give to an employer that's asking, how do I respond to questions from coworkers about somebody who's either exhibiting symptoms or is absent from work for 14 days, for instance? What can I share? What can't I share? How do I allay their concerns?
Right. You cannot share any specifics about a particular individual. You can share specifics about the company's policies and protocols, meaning what you are doing to prevent the virus from entering the workplace and from preventing people from being exposed to the virus. You can certainly talk about, efforts the individual can take. Employers can refer employees to the CDC themselves to take a look at the guidelines for themselves so that they understand that what their employer is telling them is consistent, right, with what the CDC is recommending and such. With respect to someone showing symptoms in the workplace, what we are recommending for employers is that employers just check in with that individual. Do not make any assumptions such as, do you have the coronavirus? Do you have the flu? Do not ask those questions. But if they've said that they've witnessed somebody feeling sick, the HR department can follow up with that individual and say, hey, are you feeling okay? We had a report that you may not be feeling so great. And if the individual says, no, I'm fine, that is the end of the inquiry. You cannot push further. Managers and supervisors should not be asking medical questions of their employees. Have your human resources department do that. Have your risk department do that. Have your safety and health department do that. Whatever is appropriate for your organization. But remember, direct leaders and managers cannot get medical information under the ADA. This would be considered a medical inquiry, so you want to be sending your HR team, your occupational health team, your safety team, whoever is appropriate to check in on the individual. Do not make assumptions, do not push, do not demand a doctor's note if they tell you they're feeling fine. You can continue to monitor the situation and check in to see if any further symptoms have developed, but at the end of the day, you can't go much further than that.
Perfect. So, Mark, why don't we...
And then for return to work, just quickly on that, we have all this, and I'm going to turn this over to Mark. Remember medical documentation, fitness for duty, ongoing follow-up with individuals, et cetera. Make sure that you are doing that. And it looks like you already took me through the inquiries from coworkers, so I've got that covered. So I'm going to turn this back over to Mark.
Okay. Before we get to premises liability, I want to make sure that you all have the code number for CLE credit. It's SS for Seyfarth Shaw 3220. So let me repeat that. The CLE code is SS 3220. Okay, as far as premises liability, Ben, just briefly, because I know we want to leave a few seconds here or minutes or nano minutes for questions. If you own property, if you're the landlord and you have tenants and you find out that there has been some type of a diagnosed coronavirus incident in your particular building, you should have a heightened sense of that. You obviously will not, as Tracy's pointed out, we're not going to be providing any information on individuals, but you may need to respond to that in terms of being able to assure people that, for example, we are maintaining a hygienic facility. Thus far, the virus is not very hardy. If it's on a surface, it doesn't live very long, but that could be situations where we have to keep washrooms and other areas properly disinfected and sanitized so that somebody doesn't use the handle on a sink and then put their hand to their nose or their mouth, and now all of a sudden they're infected because there's a live virus on the handle, or other means of in the elevators, the buttons on elevators, the access doors, things of that particular nature. So let's have good sanitation programs in the facility so that we can prove that we are taking that aspect of it, which is to try to prevent cross-contamination by someone someone having physical contact with a surface that is contaminated. So the last slide is the employer action plan. I think we've all talked about that, but I like to put it into these silos. The first one is information. As this thing gets really revved up, there's going to be just about as much misinformation as there is information. So as I pointed out and Tracy pointed out, there's a wealth of information at the CDC. In fact, that's one of the few things you get your taxpayer money for. They have good little fact sheets there that you can copy, you can post, you can share with your employees. And in fact, some of them are even translated into other languages if English is not your employee's first language. So get the information out. If we don't know that, how can we have anything else? The next one is they're sick, get them out to a doctor. When in doubt, send them out. And as Tracy pointed out about bringing people back and signing a fitness, if I get a fitness to return to work document that doesn't look like it's somebody who knows anything about infectious diseases, I know you're supposed to rely upon that. That might make my eyebrows go up a little bit and say, wait a minute, what do you know about coronavirus? You just signed off and said this person can come back to work, particularly if they show up and they're coughing and sneezing. I think I would take a second look at that. And then the last one, obviously, is isolation. If people are quarantined, they're not going to share it at work. If we have to get people out of the workplace who have underlying health conditions where the coronavirus might be a peril to their continuing ability to stay alive, we got to get them out of the workplace. And then the optics are very important here. And I echo exactly what Tracy said. In the majority of the cases that we've dealt with over the last few weeks, employers are saying, these are our valued employees. We don't want to put a hardship on them. We may not have to pay them anyway, but we're going to pay them. And you certainly don't want somebody going to the media saying, they sent me home, I live paycheck to paycheck. I can't buy food for my kids. I'm fine, but they sent me home. We don't want that. So, Ben, or do you want to?
Yep, just one quick follow-up on the point Mark made about the, questioning the doctor's note. He is right. It does make you very, very concerned, but the EEOC is not relenting on its position. In its most recent guidance, I don't dispute Mark's concerns, and I'm sure many of you are going to have those same concerns, but the EEOC is not relenting on its guidance. It's also even suggesting, as a practical matter, doctors and other healthcare professionals may be too busy during and immediately after a pandemic outbreak to provide fitness for duty documentation. Therefore, again, this is according to the EEOC, not your presenters here on the phone today, new approaches may be necessary, such as reliance on local clinics to provide a form, a stamp, or an email to certify that the individual does not have the pandemic virus and can return to work. So, just sharing that with you so that you have the full guidance. I know that's probably making Mark, as many of you, uncomfortable, but nonetheless, I wanted to make sure you're all well informed as to what the guidance says.
Thank you, Tracy and Mark. So let's get to some of the questions. We've got more than 500 of them, so we're not going to be able to answer them all, but let's use what time we have left to answer some of them, and we may even run a little bit over. We're happy to stay and continue to answer questions, and people can drop off as needed. First one is, can employers request a doctor's note before an employee returns to work if they have not exhibited any symptoms of the coronavirus but have recently traveled to an area significantly affected by an outbreak?
Yes, the answer to that is yes. Even the EEOC agrees that that is a legitimate medical inquiry under these facts and circumstances.
Okay. Okay. One participant notes there seems to be an inconsistency between the guidance to not inquire but that you can still send them home. On what basis can you send someone home? And then we've seen other deviations of that question. What if somebody refuses to go home even though they're exhibiting symptoms?
Yep, so that's an excellent question. If they are exhibiting symptoms and you have a legitimate good faith belief to send them home, you can send them home. This is no different than the reasonable suspicion circumstances when it comes to drug and alcohol in the workplace. We recommend you have 2 observations, not a single observation, 2 observations of the individual displaying the symptoms, and then send them home. The reason you can do that is, as the EEOC even acknowledges, given the potential for a significant outbreak here, employers have to take what they believe to be reasonable measures to address this. And if someone is displaying those symptoms, then by all means. Now, if they're displaying symptoms of something completely different, you do not get to say, well, I'm afraid you might get sicker or something else might be going on, so I'm going to send you home. For example, if they're not displaying flu-like symptoms, but somebody has asthma or some other condition that may impact their breathing, and they see that someone's struggling to breathe one day, that doesn't mean that they have the coronavirus. As the EEOC acknowledges, many people can have many different disabilities that will manifest themselves in the workplace. So make sure to establish your reasonableness. You are showing that you observe the symptoms that are consistent with the virus, and that was the basis for your decision-making and your actions.
Okay, that's a great answer, Tracy. My ability to access the questions is freezing up. If there are maybe 1 or 2 more that you and Mark can see there that would have particularly wide applicability, maybe address those, and then we'll end the call.
Yep, so one is, if you're asking people to stay home, do you have to adjust your attendance policy? Yes, you can't kind of have it both ways. So they can't be penalized if we are quarantining individuals or if we are telling people they have to telework or if we're telling people you just have to stay home, period. So you will have to make adjustments to your normal attendance protocols. Having said that, though, you have every right to demand that people still call in and check in with you and follow your normal call-in procedures. But no, you would not be able to penalize them for doing that. Let's see here. Yeah, I'm just looking to see what else we have here. Domestic travel, are you suggesting limiting some sort of ban for domestic travel? I'm going to turn that one over to Mark. I'm personally seeing lots of different things being proposed, not only for international travel, but domestic travel. But I'm not sure if the CDC has issued any specific guidance on domestic travel here in the U.S., Mark.
The CDC has not at this particular point in time, although particularly the ports of entry on the West Coast, where we have a lot of the air traffic and traffic that's coming in by sea. They are looking at that very closely in terms of whether or not they're going to, in any way, start making recommendations that you don't travel within the United States. That's the question, to these particular locations. So that has not been promulgated at this particular point in time.
Yep. And we thank you all for all of your time on the webinar today. We look forward to advising all of you on an ongoing basis, and we will do our best to try and get back to you on some of these other questions. Thank you again, everyone.
Absolutely. And one question we got, and this will be of interest to everybody. Someone asked if the program is recorded. The answer to that question is yes. And so, Cassie, could you share with the group how they might go about accessing the recording?
Sure. All registrants will receive a follow-up email in the next day or two that will include a link to the recording as well as the presentation deck.
Thank you. Thank you. Thank you, everybody, for participating. We hope you found it useful and informative, and look forward to following up on any additional questions you may have.
All right, thank you. So this concludes today's webinar. We'd like to thank everyone for attending. Have a great day.